Good morning, ladies and gentlemen. This is Aisha Shahi from the National Health Insurance Company Dhaman, and I am part of the Disease Management Program. Thank you for joining us today in Back to School webinar. Our children went back to school several weeks ago. School can put pressure on children and parents. Getting ready for school requires more than shopping for school supplies. Caring for children's physical and mental health is an important part to start the academic year with a positive note. Miss Jamila Ahmed Al Balushi from Abu Dhabi Public Health Centre will take us through this journey. On a side note, please note that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes at the end of the session to answer these questions. Without further ado, let me introduce our presenter for the day, Ms. Jamila Al-Balushi, Senior Specialist from Abu Dhabi Public Health Centre. She is an award-winning healthcare professional with 24 years of experience in health promotion. She has held key roles as a lactation consultant, cancer control and prevention, and coordinator of nursing graduates. Ms. Jamila, welcome. The floor is yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. Sabahkum Allah bin nur surur. Thank you, Aisha, for the introduction. I'm honored today to be here. Good morning to everybody who's attending us today. I am honored to be here today with you, with starting a very new academic year with our beloved kids and our teenage children. It's very important, and I really admire and thank Daman for the opportunity that they give it to Abu Dhabi Public Health Centre to be part of this great initiative and great academic year that will start, inshallah, this year. And it's a very important topic that we have to take care of our kids and our children during this whole academic year. We will go through a lot of journeys today. Usually my presentations is a lot of discussions backward and forward, but due to time and it's not that much, we can have a lot of discussions. So I will just be specifying on a lot of most important topics in the presentation. Then I can continue the questions and answer later on. Okay, let us start this new year, academic year, with a lot of being healthy spirit and healthy renovating and enthusiasm. It is our time to give our kids a space through all the preparation, whatever it needed, from the health, mental, even stationary things, everything from the beginning, from the zero to start, and from the start until we end the year. It should not be started only for now. It should be through whole the year until the academic year finishes. So the safety of our kids, and each organization can provide different topics to each age group. But for us as a Abu Dhabi Public Health Centre, and we are dealing with the screening programs and health of the students, and we have a lot of sections related to the students and the children at the school age, we would like to emphasize from our part as a safety, it always comes first. Because if there is no safety and no health, the student cannot continue their academic year. So when they return to school, we need to make sure that all the students and the nurses are well educated, they are trained. If they have any diseases, any chronic diseases, the nurse should know all about your child before they start the school. And this is very important, and continue in the safe and educating your child. So all students, it's necessary first, they need to have all their vaccinations. All their vaccines should be available, and the car should be there always with the students. I'm telling about the vaccines because you need to be updated. The vaccines keep changing and updating, and they keep changing the vaccines schedule. It's all related to the international standards, like with the DCD, with WHO. So for example, this year you can see that from last year, actually, we introduced H papillomavirus vaccine for the boys also in the grade 9. So this is very important because the vaccine kept updated. Your child should take all their vaccine when he was born until he goes to the school. Don't worry about the other vaccine what your child will be taking, because the school will be aware. For this, whenever you start the school, they will ask about the vaccination card. They want to know what he is out. He did not miss, what he have to continue. We reach to a point that we repeat the schedule of vaccination according to his need. Sometimes it will be combined, sometimes we'll omit. But it's very important to tell your child that when he take the vaccine, he could have swallowing on the same side of the vaccine. He should have some painful place and little fever. But if there is a huge signs and symptom likely to paralyze or measles or it's blinding or any other, but it never happened, you know. But most of the vaccine side, it's always small swallowing on the arm with little fever. We protect the child from, like for example, if we give for vaccine for BCG, we prevent him from TB, we prevent from measles, we prevent from polio. So it's a lot of blindness and other diseases that we are preventing your child to take it if he will be exposed to any of those in his academic year. For this, the vaccine is very important from the birth until he continue. There will be booster doses to be given according to the DCC and the WHO. Children also adopt a hygiene and habit for including having every day using a soap, clean clothes and shoes, brush the teeth twice, wash hands is very important. Washing hands is very important. It's a key. It's a message. It's something very important that the children should do it with a washing hand. When they have to, you have to teach your child when to wash hand. When he wakes up, when he touch his nose, or when he coughs, and always we have to teach them then when they will sneeze or cough, they should do it in this way. Or if they have a tissue, to do with the tissue and throw it directly, not to keep it in their hand for longer time. Then after touching a face. Why after touching the face? Because while we speak, or anybody or any student who sneezed or cough, and you know, when a child sneezes, for example, if you have like having 30 people around you, and if you sneeze, the sneeze could reach to 15 people in front of you. How much the strength of this the sneeze it is, or coughing. For this, maybe anybody, even the teacher, if he's speaking, maybe the little of the spits comes on the child, or when he's with his friends. So if he touches his face, there is the wet that it's coming to them. Maybe they will touch it, and they will touch the nose, they will touch the mouth, and there's some type of viruses that it goes through the mucosa part, which is the nose, the mouth, the eyes. So it's very important before touching, or even after touching, they need to wash the hand. After using the bathroom, and even before using it, because they touch everything. When they clean their hands, when they keep they wash the hand before, because they will go and touch also their parts. So they have to clean before and after. Keep teaching your kids and remind them about this one before eating. So because everything's go through the mouth, so his hand should be very clean. After touching any garbage, or even if you are having pets, some school they teach the kids on the pets, and they bring pets. So if they are touching their foods before or after, and even if they are touching any animals, not to touch their face or anything. They can keep their hands up until they're washing their hands. It's a key, and it's a magic, and we did it through COVID, and everybody noticed how the importance of hand washing and how it helped in surviving, because all the germs and a lot of viruses can be cleaned and washed up only with the soap and water. Then they can use a hand sanitizer. Let us empower our kids and our students to have a healthy energy shine with returning back to the school. It starts with a healthy choices and providing a healthy nutrition for your child. It's very important. Imagine all these hours and all these times that they will be at the school having junk foods, something, nothing. There's like an empty calories that they don't get benefit of it. Your child will be sleeping all the night. So his sugar level will be reduced. It's very important to have the breakfast, because when all the night there is no sugar at all, when he comes to the early morning, he should have his protein, he should have his breakfast. Wherever breakfast, even simple breakfast is very important for him, because it raises up the sugar level slowly in the body until he goes to the bus, until he goes to the class. When he started the class, our brain nutrition is sugar. So the brain needs the sugar all the time. So whenever he will start the class, he needs the sugar. So if his body is empty of sugar because he did not have any breakfast and he was fasting all the night without breakfast, there is no use to take your child to the school if there is no breakfast. My kids are very happy with me, because sometimes I let them to be absent. If they are wake up, for example, late, or an issue happened and they did not have the breakfast, I said, there is no use for you to go to the school without breakfast. Take your snack with you during the bus, or there is no use. And really, I let them to be absent, because they will have no sugar all this time, and they will start class 1, 2, 3, maybe by 10 o'clock they will start the break. By 10:30, for example, they will have the first meal, they will be hungry, and they will start maybe with a juice full of sugar, or maybe with any junk that if you did not prepare their lunchbox, or maybe they will take from their friends. So what they will start with, then it will increase the sugar all of a sudden, that it will reach up, then it will let the pancreas to make more insulin to reduce it down. Then he will feel a little bit dizzy, drowsy, little like lazy. He's not interested. Then the next classes he will not get benefit. It needs like a couple of hours for him to maintain the sugar in the body. So it's very vital and important that your child goes with the breakfast. Even if he's late, the bus is coming, take him by yourself, or let him have his snack, at least an apple, sandwich, or milk, anything, even during the bus. A healthy lunch snack, it should be very focused. We are putting for you an example. We are adding the water. It's very vital important. Then we are putting milk or lebanon or any dairy products. We need his calcium. He's growing up. It's the age of growing up, and they need calcium a lot. Calcium and protein. Our body have a blocks. When we build a house, we put a block with a block and a block to make a house. This blocks is the protein. And between the blocks, I can make houses. So we put some cements with water and everything. And those cements with water are it's the water, it's the milk, it's the minerals, and the vitamins that you put each block of protein with those ones, so your child will grow up. In the future, inshallah, when he will be grown up, his body is that much healthy that no diseases can go and penetrate his body. He's that much healthy, his heart, his lungs, his kidney. But if all this time at the school he's not eating healthy food, and imagine how many hours until he goes back home, then he will eat then, or if he doesn't have any appetite, so you are not getting, your child will lose muscles, will have diseases in the future. So always make sure that you have different type of fruits every day, colorful. God created a lot of fruits and vegetables for us, colorful, and each color have like beta-carotene, different type of vitamin C's and benefit for the child. Make it fruit, vegetables, colorful, and a very nice design. Put some carbohydrate because he will have energy, he will play. So you can put cornflakes, like healthy cornflakes. You can put toast or bread or even pasta, any things that it's little bit having carbohydrate, protein, vegetables, some healthy snacks, then lebanon. He can divide his food accordingly, whatever he wants. Sometimes they share with the friends, but make sure to tell him that you have to take healthy choices with you. And you can create it the way that you have. You can go our website also, you can see different type and creation of the fruits and the lunchbox. Also, you can go to any websites and look for a healthy snacks lunchbook. It really benefits. I'm very happy when my kids come back to the home, and I always, first thing I do, I just look at the bag. Yeah, they finished their food, and I'm happy because I put healthy juice. Water, water, water. The body needs to be dehydrated all the time because the brain is using a lot of water, and the body use also. And if he sweat, he lose water, and if they go play outside, he lose waters. Minimum 8 to 12 glasses. Whenever it increases, much better. But the teacher should know that the students will go back to toilet because he wants to exceed those water from his body. The teacher should be aware. It keeps his body hydrated, his mind to be focused, his energy tackled, and even it lets the muscles to be, because whenever you give water, it helps the muscles to move much better because it's hydrated. So no lactic acid will be in the body and causes pain for his body. So water is very important and vital. This actually tips which I'm giving you today is just a tips, because each one of those items, it need its own lecture. A healthy lunchbox, it needs a lecture with preparation. Water, it needs a lecture, exercises need a lecture. But I'm giving a couple of tips for you just to remind your kids. And it's not only for your kids, for you also. We are reminding yourself to have your enough water at work. Keep it in front of you so it reminds you to have your lunchbox instead ordering from the cafeterias, or unless if you are having a healthy place, you can healthy lunch, healthy cafeteria that you can choose, which is okay. So put always a good choices. Then we need to do a physical activities. really the physical activity, whenever you start with your child with the physical activity from now, you are strengthening the muscle of the heart and the body. When I went to university sometimes to do body mass index, and we use the machines for universities, and they are university students, they are thin. They are thin, but when we go and do the blood test, they have high level of cholesterol, but they are still thin and they are still university age, and they don't have muscles because they did not use the body. They don't have protein in their diet, and they are not changing those protein in muscles in the body because they are not doing exercise. So exercise put back all the calcium from the food and everything, and it deposit in the bone. So you need a healthy bone, not easily to be fractured. Whenever he will fall down, he will not be easily fractured. We have kids who just, if they slip, they will have fracture. Why? Because the bones are not very strong. Why? Because they don't have calcium. They don't take it from dairy product. They don't have calcium from the, for example, omega, from sardines or from fish. So this is all important phosphorus and elements for the child to have. And at the same time, you want to have a strong, strengthen the heart muscle, because muscle should be strong. So whenever he grow up, no disease will come, like disease in the heart, disease in the lungs, all will be affected. So also it increases our good cholesterol level, HDL, and it reduces the bad cholesterol. And this is all because of exercise, and walking is the minimum things. Regulate body weight if it is combined with diet. 20%, the sport, it will be the effect of the sport, 20% on the body by strengthening the muscles and losing weight, but 80% is on the food. But on the kids, it will have more effect than adult. So it's very easy if your child having an obesity or obese or an overweight, this is the right time. Even before grade of 6, when you see in grade of 6, this is the puberty time, the child will start to increase. And you can notice most of the children by grade of 6, 7, they start to gain weight because it's puberty changing of the hormones in the male and the female, and they want more food. They will start with the junk food, and they are teenage now. It's my choices. No, still we are parents, and we need to look at them and to their choices. So still we need to. So when you see that your child at this age start to gain weight, stop. This is the most important time to retain your child to the normal, because if he gain it now, it will be very difficult to reduce it later on, because it affects on the body and the body fat, and even in the genes of the body if he have even gene-related obesity. Maintaining healthy blood pressure, and imagine there is kids who are having high blood pressure and they didn't know, and this is what we'll discuss later on in the monthly, the comprehensive screening. Regulate, improve quality of sleep. When you do exercise, your hormones, your happiness hormone will be raised up, and you will be happy. Then they will sleep nicely. And enable the focus, because you know one of my child, actually 2 of them, and I am actually, we were ADH, and before they go to school, I had a trampoline. So before, when they wake up in the morning, I know he will have ADHD, he will not focus. So what I was doing, I was putting them at the trampoline and sometimes in the swimming pool, and early morning, and I jump with them also. So they do some swimming, and they go to the trampoline. I took all their ADHD that they have it. Now they will be focused. So this is the time they will go to the school. They don't have that much no attention, and they will focus directly to the class. And really, the marks was high, the concentration was high when I start this time. It depends on your kids. If they're hyperactive, you have to do your own way. Let them play in the morning, do some rope jumping like this. Before they go to school, really they will be focused, and they have their snack. So think of that, this mechanism, or you can consult also doctors related with a hyperactive child. Recommendation, it's in general for kids and for adults, actually, minimum of 30 minutes physical activity, like 5 times per week. And when we say about physical activity, we mean like your child really need to do an activity. It's not like walking and chatting. No, he should have a time that he cannot take a breath and talk to the child beside him, like when they're doing football, tennis, or they are jogging, or they are doing with the trampoline. He don't have time to speak. This is the time that we know we increase the heart rate. We are strengthening the heart muscles all around, and we are helping in maintaining strength muscles and reducing weight if there is a high weight and putting. Tobacco, and yeah, we are, this message is mainly for you as a parent. If you are a smoker, please, this is the right time. I would just share you in one of my experience. We was doing some of the screening by a device for smokers in Al-Raha Mall. And when I was doing that one, we are having people are coming and we are testing them. So there was a family who came to us. The husband started to do the test. It did an alarm, and it reached above like 70s and 80s that he was really a heavy smoker, and he smoked a while ago. I was worried. I said, while you were smoking, your kids were with you? They said, yes, I was doing shisha and my kids were sitting with me. I said, okay. I took the woman, the wife, and I told her, can you do the test for me? She did the test. And when she did it, it reached above 56 and it alarmed. I was really worried. I told the kids, come, please do the test with me. Each one of those kids reached to 20, 20, 20, 25, like that. I took them on a side. I said, what you was doing and what you are doing daily. This one, 20, even if someone who smoked a while ago and he came to me, sometimes it does not reach, but if you are a heavy smoker and shisha, are your kids are smoker? Then the woman, when she saw the result of the kids, her eyes start to tear. And I told her, what's happening? She said, actually, I'm doing shisha with my husband and our kids sitting beside us. Like she is killing her kids. Passive smoker, it's very, and they're more prone to have the diseases and die even before the smoker itself. And imagine the kids were around them and they absorbed all the poison that comes from the parents. And really, we give them an appointment and they went to go, and she said, no, from now I will quit smoking. And she felt the guilt, and she felt how she's affecting, and in Islam we say nobody, la darara wa la dirar. We should not affect anybody's, and we should not harm. There is no harm actually. So this is different type of smoking that you do it, and your kids will learn from you and they will do it. And check about your checks, especially the kids who are in teenage. I did not put the electronic cigarette now because still there is a lot of studies, but really, if your child have a USB, look at that USB. If your child have an Apple Watch, look at that Apple Watch. If your child have a special timing, he just goes and disappears, check. If you check with the teachers, tell them, if my child goes every time to the toilet, he wants to excuse, please tell me about that one, because this is what happens actually at the school, and they teach each other. They open the Apple Watch and they take it and they do the webs. So it's very difficult and dangerous. And up to now, really, there is a lot of death rates coming only from the vapes that they are taking, the vapes. It's very hazard. Nobody knows what it contains. And there is no satisfaction. It's just like a model, and I want to show that I'm mature and I'm growth up and I'm mature enough, so I'm doing it. It's not related to the taste or to the brain, or they want to do something, because it doesn't have that much even nicotine. It just, even no latest research what is inside it, and most of research is showing that people are dying very quickly and very soon with a lot of complication just because of that, this different type. And whenever it is more cheaper, it's having a very more cheap items in it, even if the expensive one. So it's very important to pay attention. Look at their bags, look at them at the toilets, go and check the toilets. It's your responsibility. كلكم راع وكلكم مسؤول عن رعيته. It's your responsibility now to check and go. Maybe you never think that your child thought that your child will be, even bullying, it could cause him to do it, because they said, oh, you are still child, you are not that much mature, we are using the vape and you are not, or midwaf or whatever. So it will lead him to that one. And you have a lot of stories we are reading about the bullying and how little the kids to be addicted or having a smoker or whatever. So check your child always. It's the biggest problem. And imagine like how many minutes I'm giving the presentation. Every minute, 10 to 11 person is dying from smoking. every minute. Imagine if your child smokes from now and you don't know and he continue, how much he will have a disease and complication by the grade of by the age of 20s or 30s, how much it will affect his body. He will have the disease before even other people who are having smoking lately, and for example, who smoked by the age of 20s or 30s. Every 5 to 6 seconds, people are dying. One person is dying from smoking and cancer. And imagine how many minutes we are. In each minute, 10 to 12. While we are sitting here, people are dying. This is WHO latest research, how important it is. So all tobacco products are harmful. Don't tell me this is mudwah. Don't tell me this is naswar. No, even naswar, when we study, there is a lot of difficult poisons in it. So it's expensive, and even the cheap one, it's not worth it because they put cheap things inside. Quitting smoking is not maybe that much easy, although I know people who quit. But we can encourage, and we have a lot of clinics. You go to our website, ADPHC and WHO and DOH, and you will see there is a lot of clinic you can go and they let you quit smoking. To be frank with you, my husband was a smoker. And I am the one who helped him. And he's really very glad that my husband smoked a cigarette and he smoked midwah. And midwah came because of the people around him doing so he's having. And he said, it's impossible for me to quit. I said, no, put your hands with me and I will help you. And really, more than 2 years, 3 years, he quit smoking just because I helped. There is nothing impossible. Believe me, there is nothing impossible. You can do it. Mental health preparation. Always put positive messages, put a positive message to your child. Let us share strategies with our children, equipped with him with an sized up opportunity during academic year. You will be and you will be. Wallah, I swear to you. My daughter, I teach her now. My daughter, she's grade 6, but still she's the youngest and the child. Whenever she wake up now, just when she opened his eyes, she said, Mom, I love school. Mom, I love school. She said, okay, Mom, I'm giving positive messages to myself. I was so happy. And yesterday, she said, tomorrow is the nice day, the best day for me. Why? Because I'll go to school. She started to give it and she's feeling it. Let them have it. Believe me, it really will have an impact on them. But they should be prepared, like sleeping early, everything. We'll discuss about that one. But really put these messages. Now she's waking up and she's telling, and even my housemaid is telling, Madam, really your daughter and your son, just from first time when we wake them up, and I wake them because I just go from first time, they wake up, they don't sleep back and they wake up and they wake up directly, they go and brush the teeth and they do their praise because you are putting positive things in their mind, the school is nice and she's starting. So put mentally and follow up with them. If they have any issues, tell it with them. Let them chat with you and tell you about this issue. Excuse me, I have to drink my water. Sleeping. It's very important. وجعلنا النهار معاشا وجعلنا الليل سباسا. It's very important, and it's something like globally God created for us to have the sleeping. Good sleeps will give all energy for your child to wake up very early in the morning and very refreshed and everything. It should be a sufficient, healthy sleep. During sleeping itself, it needs a whole presentation at all. But what most important messages? Melatonin that it helps, and it have part of the hormonal growth. It have antibodies for the body. During all the day, you were playing, chatting, drinking, doing everything, and you hurt your body, you hurt your kidney, your liver by food, by poison, by drugs, by everything. So when you came in the night and you came to sleep, this is the time that melatonins come and antibodies come, steroids come, and they will start to work in your body. Brain, please work more. We need to clean the spleen. Brain work more, we need to clean the liver. Kidney needs more to exclude, to take out some urea and other poisons. Please, brains, heart, pump a little bit more for us. Let us take out all this body, clean. There is some pain or place that it could be affected in the intestine. So please clean that one. This is what the bodies work during the night. Really, mashallah, how Allah created us, subhanallah, and let the body even work. But it doesn't happen unless you're having enough hours of sleeping. And I will discuss about this one. Usually I ask the attendee how many hours we need to sleep, our kids how many hours, you how many hours, but we'll put it at the end, but I will give you the schedule. So melatonin does not come unless it is in a dark place, and not any dark place. Don't tell me that you will sleep during the day in a dark place, the melatonin will come. It will not come, because God created that one to be when the whole earth, actually, yani the whole earth or the whole place, it will be in dark, like it is a night time. When night comes, the melatonin starts and the growth hormone. It will start to in your body of your child, and he should have enough hours. Like each cycle of breath needs of sleep needs 90 minutes, like 1.5 hours. This is one cycle. You have to complete it. Then again, another cycle will come. Then another cycle, it will come. It's a huge one-day presentation just for sleeping itself. It have a lot of information, but your child should have how many hours? For newborn, we need at least 16 to 18 hours. They will just wake up, drink, and they sleep. They just wake up, drink, and sleep. A little time of with the parents changing. Preschool and pre-KGs and 11 to 12 hours. It's very important, because during the sleeping, hormonal growth will come out. Your child will grow up during sleeping. They grow up, they start to grow up, they will have the length, and this is all because of hormonal growth. It comes, and melatonin and the hormone that it helps the body. School age children, at least 10 hours, for example, if 14 age are 9 to 10 hours, maximum 8:30, 9 o'clock, they should be sleeping continuously. Don't tell me your child does not sleep. Take him with your hand to your room, close the light, they will sleep. You just put them, it is like احنا نقول طاقة كونية. It just come, and you just put them in a dark place, close the light, try to keep all mobiles, everything away from them. If in another room, it's much better. Put your alarm to be electronic if you need, but if your biological hour will be normal, there will be no need for any alarm. And it's happening now, alhamdulillah. We just wake up without any alarm, because we just keep it just in case, but nothing. We put the alarm that it may tit without our telephones. We keep it outside, charging outside, not in the room, because paramagnetic, it affects even the mood. And should no light be there. Don't tell me green light, red light, blue light. No light should be there. Always it should be dark. Try let your kids do it, because we need all this darkness for the melatonin and other hormones to come. And for us, we need 8 to 7 hours at least. So please give your sleeping time. Wallah, sleeping, it's a lecture by itself. It needs one day lecture. So there is also other things. So we spoke about nutrition, water, and other sleeping, which is a healthy lifestyle. That was only about the healthy lifestyle. Bullying happens, and it happens a lot. So you have to talk to the trusted. Tell your child, if you have bullying, go to someone who you trust. One of your teachers, one of your colleagues that you trust, who can take care of you, or a specialist, or the counselor in the school. When they bully you, they give you, make bullying to you, stay calm, stay confident. Don't show that you are annoyed. Don't show that there is anything is happening. Just be confident. It's not annoying me and nothing. They will be scared, and they will know there is no benefit. So let them having this one. Let your child have the confidence. It's not affecting me. It's not, but I will let somebody to know about that one. Report an incident that it happened, because they have to take up. It happened to my daughter, and I went to the school. I visited. I did, and I give the name of those students, and they talked to them. Everything changed, and my daughter was very happy to go back to school without anything. Keep evidence that a bullying happened. Somebody around you, tell your child. If somebody around you, tell the children to know that it happened to you, so people will know. Or there is a message they will write. keep that message with you. Build a support network, some more friends with you, or they will see anybody who will do the bullying, they saw you with this network, they will not allow you to do any bullying. And always professional help with someone who can deal. I did it quickly and I went and directly. And you as a parent should pay attention to that one. Don't say that, no, it's just you are a little bit sensitive. No, pay attention to that one. My son, he's now 23 years old. When he was in grade 1, he had a bullying. I went to the school and it was something very simple, but I pay attention to that one because I give manners for my son. These words, we don't say it, and those things is something prohibited. It's maybe something normal, but for me, I told them this is prohibited in our culture or in my family. So when he told me about that, I went to school and we talked to the child, and I gave him the importance that I give to you, that really, because mama taught me those things and she paid attention, it will stick to his mind. You know, until now, he's now 23, until now, he's not forgetting that one. He's remembering that he was grade 1. I came to the school for something was very minimum, but I pay attention. So pay attention to your kids and go and be with them and support them when they have bullying. I did for my daughter when it happened, and alhamdulillah, it stopped. Extra things that you have to do with your child. Visit the school. Go and visit, show them, show who's the father, how you are important, how you are taking care, how it's be with your child that day, remove the anxiety, show to faculty that you are interested and you are helping and you are and caring parents to your child. Stay organized always for you and your child. Put the calendar, put a plan, what they have, what is needed, put it for your child, keep it on a wall. Make it always there. You have exam here. Let us do this plan here. You have this is here. So put that one for you and your child. Go do shopping with your child for the school supplies. He knows what he needs. Don't buy. Let him feel it and do this. And whenever he will buy something, I will use it for that one and I will use it this one. My daughter, she's the one who broke me. Always she have small new ideas and new things to buy. And let's have this is a spirit of having happiness of that one. If your child is not interested, there is an issue. So let him come with you. Let him have this spirit to buy and go it with you. New bags, new things if you want. When you start a new school, do extra. Let us start together, be together, adhere. You also should be adhere to traffic lights. Students, when they come from the bus, they have to sit in the bus, how they have to take care of the bus chairs, stay. You have to take care of the traffics, of the lines for the parents, for the students to walk. This is very important. Also, the safety for you and your children. And always we say safety first. Also, choosing a right bag for your child. If he's small, he should be trolley. If he will carry it up, and now the teenager wants to carry it on one side, but still it should not be heavy, should be together. And there is a lot of tests we have to do it for your child, but always choose the right bag for your child. Age, size, heaviness, and whenever out of box, he needs to be pulling this bag with him with a specific way. We are done mainly with the, I don't know how many times still we have Aisha, inshallah, we'll continue. But that was more mainly about some tips and information. And believe me, each one of those tips need presentation more in details. And we have health promotion team who can give you more details about each topic. Now, the most important things that your child, even your child, you are away, maybe you are busy, you don't have time, you don't go to the clinic, you don't do the test, don't worry. Abu Dhabi Emirates provided all the necessary tests, and we have school screening programs that you are providing all the tests for your child. And even like, for example, you have faculties and teachers, also there is nurses who take care of your child and doctors. So screening program is very important. We give update to prevent examination for the we have standards, and we are raising awareness to the parents and give them more information about the examination for the child. Why we do examination? We detect early detection. The parents could not be aware about it, and then they don't know it and they don't tackle it, or they are busy at work and they don't have time. And the child are not talking, for example, they don't say, they don't say that they have a stomach pain, or they don't want to show up. So the nurses and the doctor are most experienced person who can tackle and see if there is any of those diseases. So we look for early detection of the diseases, prevent any development of serious health problems in the future. Like if you have not a vision problem, hearing problem, so maybe you are not aware. My daughter Sarah, when she is now 21, when she was at the school, she saw me. She discovered one of her students. She was in grade 5, and she said, "Mom, there is one of the students. She looks like that, and she doesn't look at the. And I feel like she doesn't see nicely the board. And when she reads, it's not." I told her, "Okay, try to talk to your teacher, and she will take it." And really, it happened. She talked to the teacher. They took her to the principal. They requested the mother to do eye checkup, and this one was long time, and really she was having difficulty in vision, and she had to use glasses. And then they awarded my daughter. So let your kids be also an ambassadors, and to tackle and see if there is anything, let them talk to you what happened. Really, I have a lot of scenarios, like midnight scenarios with my family and my kids, how they tackle and they see. So it's very important to see things and prevent, because it will affect their academic. We have 2 types of screening: comprehensive screening and annual screening. Let us first talk about the annual screening. Annual screening, it happens at the school, and it happens by the nurse of the school. And always, if you have a number of the nurse and your child have any other diseases, you have to make sure, take the number of the nurse, communicate with her, talk to her, and tell her that my child have this and this. This is the problem. If he's diabetic, if he's using glasses, if he's having any issues, it's very important. So for annual screening, it happens from KG1 up to grade 12, and it's done by the nurse. We check for BMI, for obese, and even underweight, vision test, health education given if it is needed, and immunization record, and give the immunization at the school. And this is how the report will come to the parents when they will do the test. If you don't get it, you can ask for it, or it comes as an email, it comes as a text message. You will download it, but you should have this one every time. Or sometimes some of the schools use their own report, but it's fine. But at least if you are having all the tests from the test, it's done. Comprehensive screening program. It happened in Emirates of Abu Dhabi, and we are using it, and inshallah it will be national all over. Inshallah, Emirates, it's happened. It will be a national and complementary for all schools. It's done by a medical team from Safa, by a mobile clinic, will come to the school. By that time, the nurse has taken all the consent form from the parents. If you did not receive it yet, please check with the nurse and get it. They will send you the consent form. You will sign all the consent form. You will take it all. Then your child will come, and the school is ready. The clinic will come. Who will be coming at that time? It will be a medical team: doctor, dentist, nurses, phlebotomists for the blood test, and they will do it. Okay, which grade? KG1, KG2, grade 1, grade 5, and grade 9. What will be those screenings? We will check the vital signs, and especially blood pressure. It's very important, because we are discovering kids with a blood pressure, it have a problem in the kidney. Family are not aware and how it's developing, or heart problem, and the family are not aware. Here the screening benefit will comes. Body mass, disease score, either underweight or obese. General clinical examination, including scoliosis when the back is not straight or changing. And really take it an advice from me. Don't wait until we discover that he's having it. Take your child before even developing scoliosis. When developing scoliosis, this is the time that you will go for a surgery or physical examination or physiotherapies, and it will take times and years until they will fix it. Or he will use a brace, different things, and the child will not be happy. So please, from now, your child using the machines, don't put the head down. Let them, if they will use the laptop, should be always up little bit. If he sleeps and look at it's much better, because the head is very heavier than all the body. So when he do the curve, then he will have a hump. Or when they lie down and they don't have it straight, or they carry the bag on one side, the muscles are still, the bones are still growing up. So imagine you are growing those one, and for almost like how many 10 months this child going to schools and he's curving his back. So please tackle it before, look for the ways how to prevent it. It need another presentation, and tackle it before. Don't wait even for the examination. Go and check even in the schools. But the nurses and the doctors are available. This is for grade 1, 5, and 9. Do it for those grades or that they are not in this year in this comprehensive, like grade 2, grade 3, grade 4, grade 10, grade 11. Those are not under this comprehensive screening. You can do it for them. Then we do the blood test for anemia. So for grade 1, which is year 2 in other curriculums like British, so it will be for girls and boys. But in grade 9, it will be only for grade 10, grade 9 or year 10 for girls only. So I'm repeating it, for grade 1 and for grade 1 or year 2 for girls and boys. For grade 9 only for girls, okay? Which is year 10. Then, which is most important one for grade 9, we do depression screening program. There would be questions, and those questions actually, and then we give health education. I will talk about depression in a moment about it. Then any topics that we saw there is a difficult, there will be health education about this one. So what we require from you as a parent, please sign the forms. Submit any following documents like a copy of valid ID, UA ID, front and back, so they will check with it. Follow up with a referred physician, because any defects will come with your child, anemic or scoliosis or hypertensive or vision or hearing or any other disease, or BMI is underweight or overweight. They will give you a referral by a message, by an email, or the nurse will call you. Please go directly to the referred doctor, follow up with your child, not to make those diseases to be more, it will be more difficult to be treated in the future. And if your child having any disease, or he's having hearing aids or wearing glasses, or please let them bring them on that day of treatment, for example, because they need to check and to know. Because usually there are kids, like every year, if they have really a problem in the vision. Yesterday we discovered one child, he's using glasses, and when they did the comprehensive screening, from the last year academic year until the year when the mother took him, there was she had a baseline from the before. So when she did again the test, it's minus 0 point another, it's more minus within 1 year. So bring the glasses, maybe it's not the right glasses right now, maybe it become less, so he need to change the glasses. And why? Because all of these things will affect his academic year, his achievement to be. By the way, comprehensive screening program is done for ثقة holder. Comprehensive screening program done for ثقة holder. For you, the people who are not ثقة holder, thankfully, they make it an aid of only 200 dirham, and it will be settled with the nurse. Only 200 dirham to do all those comprehensive screening program. It's like you are paying نص dirham, 0.50, يعني 50 coins each day or each month for your child health, which is nothing. So it's very important, because those actually very costly, and it will have a lot of cost things to be done. So it's very important. If you would like to have it, and we really advise you to have it, put it part of a screening, and it will be only 200 dirham. You will check with the nurse at the school, and they have the process how to pay it, because it will go back to Saha. Even not to us, it will be to Saha, because they bring to you. So it starts from registration, nursing assessment, doctor assessment, examination, dental examination, and I will tell you more detail then with the lab test. And there will be specific place. We do the blood pressure test because we are checking for vital signs, including blood pressure, looking for any hypertension or possibility. And there is any clue or detect, they will send you a referral to follow up more. Body mass index, if he's overweight or underweight, and both of them need a referral to nutrition and the doctor to follow up with them and see. If you go for a vision test, because each year if the child is having, actually, sometimes the parent doesn't know, and especially with the technologies and iPads and radiations is affecting the vision, and really they start to have more glasses now than before. So it's very important, and they will send you hearing tests. If he's having hearing aids, please bring it, because sometimes the pressure should be changed and should be followed up, and really it will delay in his identifying problems in any, it will delay his achievement, his skills, communication. He cannot talk, he cannot chat, he cannot refer back, and it happens. So really it's very important to discover that things. General clinical examination will look for lungs, for heart, if there is murmur in the heart, for example, the family wasn't aware, any abnormalities, any curve in the spine, scoliosis, for example, anything that it needs immediate medical attention, we'll do with the doctor. Then dental examination also we'll see for caries. I don't know if yes, before that, I just jumped. Depression, it will be like 5 minutes questionnaire, and there will be a mark. The child will put 1 or 2 or 3 according to the questions. It will not take more time, and really it gives us an immediate clue if your child is starting beginning of depression or more depth in depression. So this is very important for the parents to know, and screening is very important for it. Blood test, as I told you, for anemia, and sometimes if it is anemic, you will go further tests like maybe serum creatinine, if he's maybe alpha trait or thalassemia, so it will be required more treatment. Just only from one detection it could affect, and we can discover other diseases. I discovered my daughter actually from before she's alpha trait because of anemia, and I know that the hemoglobin doesn't go up, but I know that she's alpha trait, and the alpha trait have a specific way of treatment, not only giving an iron. Dental examination, they will bring a team and they will have a clinic and they will have the chairs where they will check for any fissure, and they will do fissure sealing if needed, and they will do the visit. So it saves the time of the parents also to take an appointment and go. And oral hygiene is very important because it's affect also in the health and any disease in the oral, pain. You cannot concentrate, and it will affect on the brain. It's really related to the nutrition. So we need to check all those examination and also the nutrition, because if he takes unhealthy junk foods or stickers or those gummies and it's take all the time, so he doesn't take care of the, so how many hours the decay will come in the teeth and it will be more problems. So we give nutrition. All of those things, health education will be coming among with those ones. This is the question that will be asked for the students, and this is the mark that you will put from 0 up to 3. And they will read it by themselves and they will answer it, and we'll have it in 2 languages. And here the education for grade 1 to 5, we give about water intake, hygienes, and first aid and bullying. For grade 6 to 9, about puberty, water intake, first aid, and bullying at the same time, and addiction, including smoking and injury prevention, because they will be hyperactive. Then grade 10 to 12, same, including addiction, and there will be breastfeeding, because in some countries it's a fact there is people who go to, and in other countries, so we're adding it as an important point if there is, because grade 12 sometimes they stop and they go back, and we have evening shifts, so they need to be educated about those information. Parents will be notified by message, by reports, by it comes to them, or by a call. And if you did not get it, please, after finishing for your child, if he is eligible in the same grade, please ask for those reports. What happened? What is the result? It will take time, but follow up with them. Show that you are caring and you want to know the result of your child. And this is how the report will come, because it comes to Saha, and this is how you will take it and take the report, and it will be, and they will give you details. Then you can follow up and go. And even if you discover before the referral come, but in the system, if you go, it's already referred to child. But you have the right to take to any clinic if you wish to go, if you know a doctor, a family doctor who can take care of your child. For the grades, because some people are mixing up, so grade 3 students age 3, which is FS1, he's not in his pre-KG and he's not included in this screening. From age 4, which is FS2, which is KG1, we go for annual screening. Then for comprehensive screening will be grade 1, grade 5, grade 9, and KG1 and KG2. So you have to look for at which grade your child will be. Like grade 1, he will be student age 6, but year 2. So this is very important. Then we came at the end of our presentation. This is our questions and answer. I know I was talking much. Usually I have communication between the speakers because it's a live webinar and we don't have much time. This is the QR code if you would like to put a comment, evaluate me. and have a great time. And we'll go back now to, and this is our social medias for us to follow up, because we keep adding posts about schools and messages, and there will be newly a video about the child screening program and also messages back to school. So follow ups on those media for your information, and this is the QR code for me to evaluate. Thank you very much. Aisha, the floor is for you.
Thank you, Ms. Jamila, for such an informative and detailed presentation. Now we will be moving to the Q&A questions, and we have a couple of them. So, Ms. Jamila, for the first question, what to do if a child's results showed early signs of depression or any mental health issue?
Yes, we have a team in Sahha who are dealing with those issues. So don't worry. Whenever there will be a sign, you will be consulted directly. The child will be referred, and we have a team. We don't start with any medications, nothing. They are aware about it, and it's part of the screening. And they know they have a specific way of counseling skills and looking for the signs and symptoms and the reasons behind. And there will be sessions of counseling, and the doctor will be looking at those counseling skills and will let the child to go back to his normal, and we'll know the reason. There's always a reason behind that. And whenever we found a reason, this is the time that we can look for the reason and treat the child. Sometimes there will be a severe depression. Maybe this is the time we can start with the medication, but not directly with the specific, and it will be very minimum. Those medication is not something that he will take all his life. A lot of people who were in depression, they took medication for a couple of times until they come back. So they reduce the doses. Then at the end, they become normal and they are not using any medication at all. So don't worry from that time.
Great. And Ms. Jamila, moving to the next question, how can I control the use of digital devices as it's the learning source that is used now in school?
Yes. Since not all the schools are using it, from grade 1 until grade 5, there is they don't use it much at the school. This is so far what we know. But from grade 6, they give them the laptops and they give them the iPad. It depends on the schools. In the school, they will not be all the time. Actually, they have activities. They will be on and off. They are aware about that one. Maybe some sessions will be on the board itself, and others will need the laptop or iPad just to go and answer that questions. Because most of the time they are with the screen with the doctor. So it's not all the time on the iPad or the device, unless if they have to do only the test, the question, or the exam, but they will go back with the teacher and they will have other activities. So they are not all the time with the iPad. You come back home, if you have a test or question, at least he's walking it. Try always to put the protection for the child, and all the time try to, when the distances between you and your child and the iPad, answer the question, finish it up. They want to play a little bit, so now he had little bit time on it, and the school, they will not be all the time on it. Then they will have activities and playing. Then they will go back again back to home. You will do some tests or homework if there is. But when he the time, then he will go and play, do his work, maybe watch TVs. He will use again the iPad a little bit. Give him not more than 1 hour to play. Always you control by yourself. According to, there is a lot of app you can control. But for me, I have a child who's teenage now. He's 14 years old. He knows that this time mom is coming. I take the gear of the PlayStation and I take the iPad and the telephone from him. My daughter also, they know, mom, they know I take them and I keep it away from them. They go and sleep and they play with us and we chat after sleeping. Parents can control. Don't let your child control you. Believe me. There will be negotiation and that, but still you can have this time. Inshallah. I hope I answered the question.
Yes, you did. And Miss, moving to another question. At what age can I start give my child flu vaccine?
Okay. We start actually from even the priority for the flu vaccine. It comes for kids, small children from age of 6 months and ongoing, pregnant women, elderly. And those who are having like asthma and other diseases, they have the priority. And the flu vaccine started, thank you for reminding us, flu vaccine now started. Really, it helped, and it helped surviving the rate of the kids, because there is a lot of asthma, and flu vaccine each year, this is another presentation by itself. Flu vaccine each year itself, it keeps updated because virus change, they mutate, They keep changing. For example, we put influenza A, influenza B, other influenza that what it's mutated and given. So every year the flu vaccine, it keeps changing. And it will be more effective for covering a lot of diseases. Believe me, I have 3 kids who are having asthma. Before flu vaccine, always I was at the hospital when they go to school and they're admitted and they will be having any like pneumonia and they will be really sick. When I start to give flu vaccine, even tonsillitis, my daughter was suffering a lot. Since I started the flu vaccine, a year passes without any tonsillitis, a year passes without any attack of asthma. Alhamdulillah, I'm really much relaxed with those one. And even if your immunity is less, still you are getting the benefit of the flu vaccine. So please, we advise from age of 6 months, they have a specific schedule at the school, then you give it. We have an age group from age like up to grade, up to age of 5 or 6 years. Actually, there is a special team, communicable disease related to that one, but we are giving up to grade of, up to age of 5 to, I think, age 9, they will have 2 doses. Then an ongoing, when they grow up, they will have only 1 dose. But each year we started from now, take online the appointment, go to any our nearest clinic to your family medicine clinic, and it's free vaccine that you can give it to your child. And it's best time because school started and we are start to have different type, and COVID could be there also because it doesn't disappear. It's a disease and it's available, and you have to protect your child. Hand washing is a secret, including the vaccine.
And Miss Jamila, on the mention of chronic diseases, someone is inquiring, my child has type 1 diabetes. How can I ensure their safety at school?
Yes, you have to always to be with the nurse in close monitoring and the teachers. Teachers, very important. The nurse and the teacher are aware about hypoglycemia and hyperglycemia signs and symptoms. There is no harm if you go and check and ask again and check with the nurse and inform. They have a special care, actually, those children at the school. Make sure that your child took the medication right time. If his medication should be in the early morning, you have to inform the teacher or the nurse from the beginning of the year that my child took the medication. Maybe the glucose monitor will be less. He have to check at this time. The teacher or they should give him a space to check. Maybe he will go to toilet allowed to urinate. The teacher should be aware about that one, not to stop him from going to the toilet, because this signs, for example, or he's going more to the toilet. Why he's going more? Because maybe it's high. Also, the lunch and lunch box should be very healthy for him. Teachers and the faculty should be aware about that child and about signs and symptoms. And here you will be relaxed that my child is taking all the care and they're aware. And it happens, really, they are very supported, the faculty. They check, did you take your medication? Did you take your injection? Did you take your tablets? For type 1, there is only injections. What time he's taking, what time he could show, and they will be aware. Alhamdulillah, we did not experience anything, but the faculty and the nurse should be aware about that child. So this is your part, parents, to make sure that you visit the faculty, taught all the teacher about him, and they will take really, and the social worker take care of your child and the healthy lunch for him.
Great. Good. And Ms. Jamila, for our last question for the day, how can I handle the child's fear from going to school, especially if it was his or her first time?
Be with your child. Be with your child. Go the first day with him. Go the second day with him. Go the third day with him. All of them, they will experience that. Wallahi, mashallah, now, most of the children, they are really, yani, mashallah, yani, I have, we saw one of them in the nursery. She have a 20 child students, maximum age 3 years. They are telling to mama, go. They are more exposed to the community now. They are most exposed to all of this one. You, as a parent, if you expose your child always to go to a park, to go to places, be with them, they will not have that fear to be in a community where there is friends with him. Always there is a friend. So first, you be with him in the first day. Show him how he will be a hero. Show him how she will be a princess. How it's very important for him to be at the school. What he will be. Be with him at the first class with a couple of hours. Then I will go. Then there is no fear. This is same as your family. Always with you. You have to be with them and let the teacher little bit pay attention to this child little bit at the beginning, because they will have the fear. Follow up, be at the school that day. For even the government give now 3 hours free for the parents, for the especially they are having KG1, KG2s and grade 1 new schools. They're giving because they know the importance of that one. Support them. Next day when he come from school, show him, wow, how it was, who's your friend, what you are taking. So it will have first day, second day, until they will fill up. We are all experienced that one. But always when you expose your child to a community around him, you are always telling him about stories, about the schools, and being with your child, this fear will go slowly and slowly, inshallah. And you can read more about that one, because they need a counselors also, sometimes some children. My daughter, sister, she's telling her son, said, yesterday I went first year. Why today I have to go? Every day I will go to the same place? I said, yes, you will go every day to the same place. But this fear will go by, let them visit the school before, have the atmosphere. And if you will put your child sometimes in a pre-KGs, it will help a lot for him to reduce this fear as a KG1, KG2, and grade 1.
Great tips, Dr. Ms. Jamila. Thank you very much for being here with us today and giving this very informative presentation. Dear audience, this is the end of our webinar. Please take a moment to answer the survey questions. Your feedbacks and inputs are appreciated. Moreover, note that you can view the reply of this current webinar as well as previous webinars in our YouTube channel, Dhaman Insurance. Thank you again for joining us today, and special thanks to Ms. Jamila for your valuable input. Looking forward to meeting you all at our forthcoming webinars. Stay safe and enjoy the rest of the day.
Thank you very much, Habibti Aisha. It was my pleasure to be with you today, and I'm wishing a very safe and nice and inspiring academic year with no diseases, no injuries, nothing at all, inshallah. Thank you very much and take care and be always safe.
Thank you, Doctor.
Okay, nice.